First off, the payment was not made by the 16th of February, it's a few days later. The payment is apparently going to be made on the 27th. It's an 11-day delay. Is that not reasonable? Is that not within reason?
No, it's not, quite frankly, because we had this assurance for the 16th. We also had this assurance for the end of the January wages, which was going to be on the 27th of January. And again, we actually had to prompt the GHA actually at the end of 2023 and in the autumn to make sure these payments actually going ahead. The GHA didn't even seem to be aware until it was our nursing reps across the hospital and the rest of the GHA that actually raised this to management. They clearly haven't communicated amongst themselves, despite us coming to an agreement on an SOP document back in June, and they've clearly not put the infrastructure in place to get that done. The 11-day delay is not acceptable for the very simple reasons. We had several members report back to reps and to ourselves in the union that they were dependent on that money coming in. If you pay your rent 11 days late, you get in trouble. If you pay a bill late or a fine late, you could potentially get in trouble financially there. The government and the GHA feel that rules don't need to apply to them. I mean, we're coming up to now the 4-year anniversary of COVID. We were out on balconies every night banging pots and pans in support, and now the GHA can't even do payments on time. It's a joke.
Okay, and we've heard from the government this evening that implementation of the agreement had failed on both sides. There seems to be some acknowledgement that things haven't gone right on their side. Do you accept that things have not gone right on your side as well?
No, because we're not the employer. If the GHA wants to relinquish or some of the ability to make sure we're able to pay people on time, believe me, the union would look forward to having that responsibility. We'd probably do a better job than them. It's not for the union to make sure employers pay their staff on time. That should be a standard operational thing that they do, and an employer as well established as HMGOG and the Gibraltar Health Authority shouldn't need prompting as to when to pay their staff and to when to do it on time. For that responsibility to fall on the union is nonsense. It is their failure, which they've acknowledged in written apologies. But quite frankly, that's not good enough for our members who are reliant upon that money coming in. And it also should be said that actually that money that is paid for the extra days is having to be paid because, again, there's been failures to make sure staff can take those days in lieu. Staff are tired, there is short staffing in many areas across the GHA, issues around skill mix and so forth, and staff wanted to take those days off and have time with their families that they may have missed on those bank holidays. They've not been able to because, again, there's been failures to accommodate that due to the short staffing, and it's a failure purely on government side. The union is not to blame for this. It lies squarely with the employer.
You said with the employer, this is coming from the Ministry of Health. The Minister has said that she does not get involved in HR issues. She's communicated with the GHA. She's got a response in a few days. Do you think that's sufficient? And where do you see the issue lying? Is it on the Ministry side, the GHA?
It lies on both. There is a clear disconnect and a miscommunication between the two. Now, what we've always advocated for is to have minimal political interference into the Gibraltar Health Authority, but that's not none. It is still a government authority. So what can't happen is when the GHA fails, they are simply hung out to dry by the Ministry of Health, but then when they're doing some things that are very good, that is then, as the badges and the medals are put on those within the ministry. We don't, if it's up to them to work out internally from a senior management perspective and a ministry perspective what went wrong here and correct it, not try and put a proportion blame on an organisation that represents its own staff and the frontline workers that we all depend on day to day. They need to take some responsibility and face the fact that they've messed up here and they've got to correct it going forward.
Okay, and looking forward, how do you see the situation? Do you think that something can be found that is amenable to both sides? Well,
unfortunately, I think what we've had to do in putting out the public statement and demonstrating to not just our members but to the wider public some of the issues that we have to confront and the level of incompetence we have to confront as a union on the day-to-day basis from areas of the public sector, I think this will be a warning to them to not behave like this again. We shouldn't have to be fighting to make sure staff are paid on time. So I think going forward, they will be very keen to make sure this is rectified and they're not embarrassed this time next year.